Hi, good afternoon and Assalamualaikum. My name is Siti Asma Binti Azhar. I'm a student from UM Seberang Jaya, Penang. My ID number is 9107280251080001. I'm taking a course for the Bachelor of Nursing Science with the honors. Today I would like to explain about my assignment number 2 is in course the title is a communication and counseling skill for the nurses. So we go through the introduction. So for us, if psychoeducation is a therapeutic approach for mental disease. It's a combining a group therapy and cognitive behavioral therapy and education as well. It's promote dialogue and understanding with the therapists actively participating. So for the passive psychoeducation, it's involve providing brochure or audio or video resources for patient or family members to read and absorb it. In crowded clinic, it can be done by handling out plain English material as well. So we go to the my experience as a nurse in working in a hospital that we are using for the educational counseling strategy for the breast cancer patient. So we do have the strategy patient. We need to understand our symptom of the illness and provide support for their family as well. So despite it, we are normally psychological process. Cancer patient often experience such as anxiety, sadness after the treatment. The initially phase involve actively listening to patient concern and allowing them to share their opinion on their condition and therapy. It's emphasize the need for improved coping mechanism and emotional support. So as a nurse, I can provide a clear explanation and patient health, treatment, self-care techniques. So how about the LEARNS framework actually? I mean, it's a valuable tool for the nurses to improve the efficiency of psychoeducational therapy for the cancer patients. In my experience, it's involve a collaborative approach involving patient, their relative, and unpaid career as well. So the goal is we want to create a compassionate and encouraging atmosphere, enhance the patient openness to the therapy. So this approach can lead to the better functioning, reduce the symptomatology, and better outcome for the patient and their loved one. So by incorporating the learn framework actually is enhanced patient comprehension, info, empowerment, and evolving media to the treatment as well. So by the learn framework is actually more effective approach to the patient communication in healthcare and enhancing patient empowerment and comprehension and involvement. Actually, this framework is structured approach that focus on listen, emphasize, acknowledge, recommend, and negotiate, which it can be integrated to the patient care to improve rapport building, facilitate and communication, and promote patient-centered care as well. Okay, we go to the next about the active listening is a crucial in the healthcare to ensure patient feel heard and understood. This is also improve our communication and establish a rapport with the healthcare professionals. This approach to avoid assumption and misinterpretation or focusing on the patient true issue is also establish a rapport with the patients, help them feel validated and trust them healthcare provider. They need to improve therapeutic alliance and comfort in the disclosing private information. It's also by encouraging listening and healthcare professional can customize care plan to each patient unique needs of their preference. Is that empathy is also essential as it allows medical profession to establish and connection with the patient, making difficult medical materials to absorb it. So we go to the empathy and patient-centered care is a cruel for establish a welcoming atmosphere that honors each person's unique experience and preference. So we need to acknowledging the patient thought and emotional experience help clarify confusion and considered treatment related to the matters. So we need to respect their feeling, experience, promote transparency and trust in the patient-provider interaction as well. So this approach actually to ensure the medically sound plans and acknowledge and honest to the patient unique circumstances. For the next practice making specific will throw out recommendation based on each patient unique circumstance. So by the provider, as a provider, educate patient about their options and reasoning behind each advice to it in the informed decision as well. So this actually it demonstrate their commitment to the patient welfare and support personalized by customizing suggestion to the patient needs. Under medical record, it should be disclosed using a universal precaution strategy, as long as in the health strategy it can affect certain demographic group. So we need to explain to the study clearly, provide written instruction, visual aid like infographic and drawing, and refer to the trustworthy website and applications for the recommended to the patient issue. So we go to the negotiation is actually is called is forming a patient-centered care plans. Is actually is ensure the patient perspective is heard, leading to the more effective and successful treatment. Patient also is get empowered to the participate in the process, strengthening the provider-patient relationship. So for the negotiation, also ensure that their care plans consider the patient preference and lifestyle is also increasing adherence and satisfaction with treatment. This structure and clinical skill roles is growth, text, and communication skill for negotiation of patient plans. So how we learn framework help in patient help. So go through the first one is effective communication skill occur in a promoting medication adherence, understanding patient preference and developing treatment plans. So also traditional methods may be more is appropriate in emergency or hospital setting. However, when the multiple options are available, a collaborative approach is more important. So patient and clinical work together to develop a treatment plans and considering their preference, objective and lifestyle. So in psychoeducation can prevent depression from returning and future study should consider their effective approach result in the relapse rate, longer stay hospital and shorter the relapse rates in therapeutic therapy participants. So we go to the continue. It's actually is a Horning and Bennett and Morgan in the year 2003 is investigate a psycho-educational group intervention for the postnatal depression in a work women. So the intervention is include cognitive behavioral approach, relaxations, and coping mechanism related to the childcare and social support. Is after that we adjust for the anti-depression use, women in a psycho-educational group has significantly lower depression level. So in the 2000 years, Doric and colleagues also compare group psycho-education and at-home individual problem-solving session. It's a finding that the former decrease the symptom and enhance the subjective functioning. In the 2003, Column and colleagues also compare the effect of psycho-educational group session with the untrusted group meeting for the outpatient with the bipolar illness type 1 and 2. So study have connected to the result of the doctor-patient interaction with the communication abilities of the physician since the late 1960s. So in the study also, we need to know patient satisfaction after the doctor visit have found a strong link between communication behavior and satisfaction. So in the task-oriented behavior, such as is actively listening and providing through the information and emotional behavior, such as is empathy, concern, and identify a key factor. So in the task behavior, we also account for the majority of variation in patients' satisfaction. but they may be justified using a patient-centered language. So this includes avoiding direct behavior and monitoring the patient information intake. So other factors such as wait times may also affect satisfactions. So in the study found weaker correlations between the communication skill of doctor and patient satisfaction compared to the study focusing on their factor. They are also most consistent results indicate the importance of simple, targeted, repetitive, jargon-free communication which align with the fundamental of information transfer. It actually include for the non-verbal communication practice like eye contact, active listening also contribute to the higher patient satisfaction. The study suggests that effective coaching is a cruel understanding and treatment adherence. So we go through for the effective communication is a crucial for patient satisfaction and improve health outcomes. So studies show also overly is direct communication can have unfavorable effects. So recent study have a link better health outcome to improve the communication skills, including the reduced distress during illness and improve psychological measures. However, the data collection is limited, so the result vary weekly, so making it difficult to attribute the positive result to the earlier clinical communication practice. Therefore, incorporating interpersonal connection and a patient approach is essential for enhancing patient satisfaction. So we do for the regarding the meso in L study on the 416 cancer patient found that 14 reported communication failure. So we need to improve our communication. So it means it's including information exchange, emotional support and care coordination. So patient view this issue as having the same negative effect as a conversational adverse occurrence. So they hope that doctor will listen to their opinion, understand their well-being, and explain the patient condition in layman's terms. So the study also emphasized the importance of a doctor-patient relation in a high-quality medication as well. So it suggests the doctor should be personable, cordial, and share decision-making, demonstrate genuine care, and practice respect. So the study also highlight the importance of patient-centered practice, such as asking for the input, letting patients speak freely, explaining information plainly, and offering a specific advice, receiving feedback on the treatment plans, and acknowledging the patient feeling. So it's emphasized the importance of doctor understanding about patients living situation, discussion cost of the test, drug and treatment option, health insurance coverage, and providing support for the other carriers. So we research in the show in communication also we has positive correlation between communication habit of the physician and various desirable outcome. So patient with better communication abilities are happy and with a better recall, patient comprehension and therapeutic adherence being essential and also consensus about the exit on the division of competency in a patient-centered communication with the six fundamentals objective for the medical interaction, which means at first is we developing the connection, obtain the information, disseminating information, making decision and handling emotional and also facilitating behavior related to the illness and treatment. So we need to do and we need to understand the factor that hide the widespread adoptions about in the patient-centered communication skill is necessary for effective communication at the individual and system level. So conclusion by this assignment for the learned frameworks, we want to enhance patient care by promoting clear, compassionate interaction and recognizing patient experience and involve them in the treatment decisions. Yeah, it also fosters a relationship and supports patient-centered care by coordinating treatment plans with the patient unique circumstance is a value and also preference. This also approach they also approach cultivates cooperative with the healthcare environment, ultimately improving patient outcome and satisfaction as well. So this one is my reference that a few that you all can be referred here. So go next for the question and answer. So the first question is, what is a psychoeducation in our mind? So I want to explain that there actually is a therapeutic approach for the mental disease, combining group therapy and cognitive behavior therapy and education. It can be promote dialogue and understand with the therapists, actively participating. However, passive education is involved providing brochures or audio resource for the patient or family members to read and absorb it. So for the second question is that how the active listening help while using LEARN's framework. So the answer is active listening is a crucial in healthcare to ensure patients feel heard and understood in the improve communication and establish a rapport with the healthcare professional as well. So beside that is focusing on the patient truths and true issue, and also is establishing a rapport with the patient help for the feel validated and the truthful in the absorbing of the trust their healthcare provider, leading to the improved therapeutic alliance for the comfort in the disclosures, this disclosing disclosing private information. That's all from me for my slide and my presentation according to the assignment too. I hope we all understand and give the feedback. So that's all. Thank you very much. And thank you for your time to listening me.